everyone. Hold on just a moment. We're trying to get our Facebook Live going as well, so those people are able to join us. Okay, here we go. This is Lisa Hurley from York County Development Corporation for the York County Community Sector Briefing. Thank you for joining us today. I would like to introduce Laura McDougall, our Executive Director with Four Corners Health District, and start with the Health District report.
Thank you, Lisa. Welcome everybody this morning. We're going to go ahead and give an update on what's been going on public health-wise. Since we last talked, I believe we have at least 2 or 3 more positives. Tests have come in for our district. So we had last week a positive in York County, a woman in her 30s. We had a positive in Seward, the first positive in Seward County, which was a male in his 60s. And those, both of those cases, we believe they contracted the virus while working outside of our health district. The newest case came in late last night. It's our first case for Polk County, a woman in her 40s. At this point, Four Corners, where I have my nurses are investigating that situation and learning as we speak what kind of exposures might have occurred. We've also are working with the workplace to find out if anything, any exposures have happened there. So that's a brand new one, and we're putting a press release out as we speak on that one. The tests that have been, it seems like we're able to do a bit more testing in the last week, and we hope that to continue to see that. To date, so as of this whole time, we've been able to run 126 tests in the district. Now we've had our 4 positives, and right now we have 9 tests pending, and we're waiting to hear results on. I also like to give an update on the quarantines that are in place right now, the quarantines where we're also monitoring everyone. So up to, again, this whole time period that we've been doing this, we've had 248 people in quarantine and been monitoring them. And the total for York County has been 84. So presently, we only have 64 in our whole district people in quarantine. So a lot of those numbers of people were right away initially when people had gone on spring break or gone on vacation during spring breaks for schools and colleges, and they have now been released from quarantine. But at this time we have 64 people in quarantine, and monitoring them, and mostly those are people who have either they have someone who is sick with COVID-like symptoms in their household, and they're quarantining at home with that sick person, or they may have actually been an exposure to someone who tested positive. So most of those cases right now, we have very few people that are traveling at this point, which we are glad to see. Travel right now is not recommended unless it's absolutely necessary. One thing I wanted to talk a little bit about is I know that we're approaching, for some people, the Easter holiday. So just want to remind everybody, and if anybody's been watching the governor's press conferences, he's come out with a slogan now: stay home, stay healthy, stay connected. And we're going to be really reinforcing those ideas across our district as well in the coming weeks. And what does that mean for you? And this is going to be part of our press release as well. But when we say stay home, that means stay home whenever you can, whenever it's possible. Don't gather in groups, and don't visit or host people who do not live with you. So you want to really stay home, stay close to home with those people that you live with. Stay healthy. Make sure you're staying at least 6 feet distant from anyone that you don't live with. And we're doing it here today, in fact. So we're really trying to practice that. Wash your hands, wash your hands, wash your hands. Just keep doing it. That's the one thing that we have control over. And no matter what surfaces you touch, you can wash your hands and prevent illness. And then again, and this is one thing that with the cases, the positive cases that we've had, where we've been so successful at limiting the spread in our area, has been that the people who have tested positive, especially the recent few that we have, they have been staying home when they're sick, and the people in their homes have been staying home as well. So that really makes a difference as to how things spread, and it cuts down on the spread. So we're really, that is something that is so important. And again, going back to that good old work ethic that we all have about, you know, trying to muster through. In this situation, it's not good to go to work when you're sick or even have mild symptoms, because you could be exposing all those people you work with, and everyone will thank you for staying home. The last point the governor makes is stay connected, and especially during this Holy Week for some, make sure you're staying in touch with everybody. And this doesn't mean that that you should go to Easter dinner with people and travel. This means, you know, call them up, make sure you're having a conversation with them. We have all kinds of great video types of conferencing now. You can Zoom, you can Skype, you can do all different kinds of ways of talking to people. And just make sure you're checking up on your neighbors too, especially if they're alone this week. Make sure that they're okay and that they have what they need. Maybe pick up some groceries for them if you're out anyway. So I just wanted to put a plug in for those things, and I'm going to go ahead now. That was the sum of my report. I know that we do have some orders for PPE, personal protective equipment, that have come in, and we're working through trying to get all those orders approved. And then we also have to still receive quite a bit of that material. So we're stay tuned. We're going to get that out as fast as we can. So I think we'll move on at this point to the medical sector. And I see Jim Ulrich is on. Jim, would you like to give a report?
Sure. Let's see, want to talk a little bit about continuing to work with our labor pool and keeping staff engaged, as we want everybody, you know, certainly a goal on all of our businesses to keep all of our employees with us throughout all of this time. In our organization, we have one sector, our hospital, which is like all other hospitals in the area, have seen a decline in their volumes due to elective cases being canceled, elective procedures being canceled. And so we have a slower hospital, but on the other end of our other sectors of our organization, our dialysis continues to be like it was, with a lot more precautions, certainly for infections and whatnot. And then home health has seen an uptick in their referrals because, you know, wanting to get patients out of the hospital system and back to home if you can. So home health comes in bigger on that. And then our Willowbrook Assisted Living and the nursing home care for those residents in both of those buildings every single day, and their care is more labor intensive as it's more one-on-one care and not having them come together for communal, you know, meals together or activities together. So a lot more labor intense. So we've had a labor pool of individuals in our hospital that from the beginning of this and the beginning of the slowdown have been reassigned really over to either the Willowbrook or Hearthstone. And that continues to work well, but always changing needs in those areas. We were, like some organizations in town, were approved for a small business loan, which will also help, you know, through the Paycheck Protection Act, which will help us to work with our employees and keep them engaged and keep them you know, meeting their needs at home and whatnot as well. And we should be receiving.
Oh, do a dusty kitchen today.
We should be using our.
Yeah, because if we're going to York and
Receiving our
everything, I
UV
don't know.
robot and our UV
You know what?
light
I got
system
tomorrow.
that there's been a press release on. We should be
I'll
receiving
go in the other room.
here in
Finally
the
got
day
it?
or so.
Yeah, I got it. Finally.
Picking up on
That's-
something else. And so
Oops.
we're anxious to get that in so we can get all our training done and start disinfecting and reusing some of our N95 masks through that process. So making our PPE go further. And so that's the end of my report. Thanks.
Thank you, Jim. Do we have anyone from Henderson on this morning? From Henderson Healthcare? Or York Urgent Care? York Medical Clinic? Okay, so any other medical providers on that would like to give a report at this time? Okay, let's go on then, and we'll go with, and once again, I skipped over that local government sector, so I'm going to loop back around. I see we have Randy Obermeyer on. Would you like to give a county report, Randy?
Good morning, all. And that's all right, Laura. We're used to being ignored every once in a while. Basically, just want to touch on a couple things. Last week, I did touch on the elections. I believe all registered voters should have received some stuff in the mail, that you're able to send into the clerk. You can get that done now, obviously, this month. As you can believe, the clerk has been inundated with many of those every day. So that process is going because the election will still go. I wanted to talk a little bit this morning about our aging services because some of those services have changed a little bit, like our meals for our seniors. That is curbside. It's available at the senior center, that the senior center is closed Monday, Wednesday, and Friday. So you can call up to Aging Services at 7626, the number that's in the phone book or on their website, and you could visit with them about what can be done. Now, obviously, most everybody that's listening today don't need it, but maybe there's an aunt, an uncle, a mom, or dad that those meals are still available for those seniors that are 60 or so and over, so they can still receive those. Transportation's operating somewhat normal. They are just wanting to go medical, work, grocery, not too many other errands are they wanting to go, just to keep it and the main things, at least for the time being. And other than that, we're trying to operating as normal as possible. I would like to take just 1 minute to thank all the community and business leaders for what we've done. I think we've done a remarkable job in this area. We didn't have a playbook for this, and we've admitted when we've done some things wrong, and we've changed those things, and I just think we're all doing a great job. So I'm going to end it with that, though.
Thank you very much, Randy. I agree.
Henderson has nothing to report.
Okay, so we're going to move on to city reports, and we have a note from Henderson that they don't have anything to report at this time. Do we have anyone from the city of York that would like to report? Okay, how about McCool or Gresham, Benedict, Bradshaw, Waco?
This is Darcy from McCool. We really don't have an update this week.
Okay, thank you, Darcy. Anyone else from a village or city? Okay, then let's go on where I'm going to get out of the way, and Lisa Hurley will have a business update.
Okay, I do have a few things to report on today. The first is last Thursday night, the York City Council approved a COVID response plan using their community development block grant funds These are available for our small businesses. However, if you are the owner, a shareholder in the company, and you are the only employee, you are not going to count. This is to maintain job employment. It is up to $20,000 in operating expenses for 3 months. You can find the application either by contacting me or contacting SEND. It's actually on our website. SEND is the Southeast Nebraska Development District. They are the grant administrator. Madonna has been gracious enough to help applicants with their DUNS or their SAMS verification if need be. So you can reach out to her for that. But if you have specific program questions, reach out to Trey at SEND or myself. You can find the application on our website at the yorkdevco.com under the COVID page as well. Now, there have been a lot of webinars on the federal resources that are available. I wanted to point out that the economic injury disaster loans does work for those that do not have employees. So, and there's an application online. You can reach out to me, or you can reach out to your banker. I highly encourage you to reach out to your bankers, no matter what your needs are. Now, we also have we did our York County, Nebraska COVID-19 Business and Human Impact Assessment survey that went out to business owners and managers last Wednesday, so a week ago, and we closed it on Monday. We had 87 responses of those, and I'm just going to do some high-level highlights, and I will be getting this out to community leaders and to the media once my final report is done. I'm still analyzing data, but out of the 84 that answered if their business was open or not, 9 said that they were closed. So we are starting to see some closures, which some of them have been mandated, some of them have been voluntary. Current operating level across the board averages 72%. So even those that are open are seeing a decrease, as Jim said. Even on the medical side, there's areas that are seeing a decrease. The current remote operating level is at 56%. So that goes back to what Laura said. We think the community is doing a good job at trying to do the social distancing. If they're able to work at home, they are. And our office here, all the staff is remote except for Madonna with the chamber, Bob with visitors, and myself. We're the 3 that are here with the front door locked, but we're answering our phones for the business community and whoever else needs to reach out. What I found this a little interesting on the decision to close. It was almost 50-50. 45% were forced. So those were the businesses that could not maintain the social distancing with inside the 6 feet, the 10 people under. And then we have another 55% that they were voluntary closures. And not everybody that answered the survey answered that, obviously, because not everybody's closed. The closures ranged in date from March 14th to April 6th, which was the last day of the survey. We will be doing this again. We are seeing that the supply chain is being impacted. Some of our businesses are having a hard time getting their supplies in, and they're also having a hard time getting supplies out, or their services out. That might be because they're down on staff. We had a great representation from all areas. We had several people where there was only 1 employee, and then all the way up to the hospital at 485. Sorry, Jim, you're the largest employer in York County at that number. You know it, but we did have several within the $100 and the $200 range. But by far, it was under 10 for employees. So the small businesses did participate highly in the survey. We did ask if their employee count had changed due to COVID specifically, and 15 of the businesses were yes. So there are jobs within the county, and these are only the ones that answered the survey, but it is starting to impact our employment level. We did have one company that's hired 3 people since COVID started. So if you're looking, there are still some opportunities out there. I'm just gonna skip down. I love that about 25% of our workforce is working remotely from the respondents as well. And the other thing I want to put out is out of 72 people that answered this specific question, our employee morale is down to about 55%. So throughout the survey with the open answered questions, the employers are really worried about retaining their employees long-term. They're worried about the financial impact on their employees. They're worried about the impact on their own business as well, and being able to keep the doors open when this goes away. But they're worried about their employees and making sure our community overall is taken care of. That's really all I have to say today on business impact, other than if you're a business owner, if you're a business manager, whether you're a 1-person shop or you're a 500-person shop, please feel free to reach out to me. I'm here. If I'm not in here, you can reach me by my cell number. It's on our website. Both of our numbers are. So please feel free to reach out, and I will do whatever I can to get you the right connections or talk through what you need to talk through. And now we're moving on to the education sector. Oops, hold on. Madonna has something here. Oh. We got to ask other businesses. I forgot about that.
Well, we'll circle back to that. So we do have something on the chat, but I'm waiting for a little clarification before I address that. I wanted to actually echo a lot what Lisa said, that we've been working really hard with our businesses. We've had a lot of business owners reach out about some clarification on the payroll protection plan, as well as some of the city grants. So we're really happy to be able to work with all those business owners and YCDC and send for the city grant, as well as connecting business owners to the lending institutions for those drilled down clarifications on those lending programs. I wanted to just really highlight and kind of dovetail off of what Lisa said about the morale of employees as well as employers in the community. And I really want to give a shout out to several of our businesses who have been supporting one another through us or through just their individual actions. We did partner with York County Development Corporation and Cornerstone Bank to support a buy local page that's powered by York News Times. Gives a lot of business owners that opportunity to upload their gift cards, and for members of the community or even members of the community that have moved to Arizona, or maybe they're still snowbirding down in Arizona, and they can buy local and support. So that's been a great way to get that out there. A lot of our local businesses, York Ace Hardware is supporting local with some programs that they're hosting. Also Coldwell Banker and NHS Real Estate, and Wally Burns, Edward Jones are promoting a gift card program. We continue to collect PPE here at the office for our healthcare systems, both York General System as well as Urgent Care. We have sent some PPE to them. We do ask that be dropped off here because they are trying to protect their very precious population and reduce their pedestrian traffic. And then tomorrow night, Peterson Pedal and AAA Storage are hosting a cruise night, encouraging everyone to dust off their cars and just drive through town. Get some grab and go at all of our restaurants. The theater's doing popcorn again. The radio station will have music going downtown to just really lighten the atmosphere, to lift the spirits of our community. And finally, lifting the spirits of our community, I really want to thank Nebraska Medical Mart for challenging the community to put their heart on their windows. And that team there has been highlighting that on social media, putting up pictures, and just sharing really great things about that individual business or individuals at that business. So really, really appreciate the support that our businesses are giving one another, and hope that that just continues. Thank you. I'll wait for that answer.
And I did forget one thing. I was reached out to this morning, and I have an ask for our medical providers. If you're a business or an individual that has a 3D printer, we have parts like the hospitals, the clinics, urgent care that they all could use. I have a pattern that was emailed, actually Facebook message to me this morning. Please reach out. I will be getting it out as well, but if you have a 3D printer, we could put you to work making some pieces for our medical providers. Now, I also forgot to ask if any of our businesses have anything they would like to announce. Anyone here on the call today? Okay, hearing none. And if you think of something, please put it in the chat. Madonna will be reading out the chats. Rhonda is monitoring our Facebook live stream as well. So wherever you're watching, you can add it onto there. Okay, so onto our education sector. I do know Mitch is not able to join us, and he said he had nothing to update today. Is Brad or Kurt from Heartland or McCool on? Or anybody in the education? Good morning, Brad.
Good morning. We don't have a lot to update. We're continuing to push out enrichment type activities and maintaining those connections with kids and families, and we try to do that multiple times per week. Seems to be going well. Probably one of the things, and this is one of, if you're going to wish something on anybody, it would be to have to rein in people a little bit, because they try to do maybe too much. And so we're trying very hard to take care of our families and reduce anxiety levels and putting family first as much as we can. So I think all the schools in this area are doing the same things, focusing on that right now. The change that we have here at Heartland going into next week, we had been delivering meals curbside for each day. And we have about 2/3 of our families in our school district participating, which is awesome. We love that they are taking advantage of that. But we are moving now to a once a week delivery. So we'll reduce the number of interactions, I guess, personal interactions with people. So we'll reduce that, hopefully, any chance of spread and things like that. So we will distribute meals here in Henderson and also in Bradshaw on Tuesdays. And we are planning to hand out probably around 1,200 meals in that hour next week. So we're excited about that. Props to all the food service people in the area by providing all of these things. They're awesome people. And we appreciate all the support that we've gotten in that area. But otherwise, we keep moving forward, trying to make plans for things like graduation ceremonies. I know some schools have set maybe late June, late July, early August as potential traditional ceremonies. I don't know if those are going to happen. I don't know if anybody can tell us that those are going to happen at this point. So the unknown is always the scary thing, right? That's what always makes people nervous. So if we knew we could pull this off at the end of July, we would set a date and do it. I would hate to get to that point and then just say, oh, just kidding, we're going to mail them to you. So we're trying to come up with some combinations of being able to recognize our seniors throughout the summer, or at least a couple different times, or have a contingency plan, if you will, in case we can't do something later on. But otherwise, things are going well.
Thank you, Brad. Anyone else from our education system? We have York College, I believe.
This is Emily Lutz from York College. Just a couple of things that we wanted to clarify this morning. We do have about 40 students still on campus. Those students have all moved into our apartments that we have on campus, so they have access to their own bathrooms, their own kitchens, and then their own sleeping space to try to keep them apart as necessary. Our campus facilities are closed to the general public, so that includes the Holtis Fieldhouse, the Freeman Center, the Campbell Center. There are a few facilities that are still open just to our campus constituents, so that would be our academic research center, resource center, and then our campus bookstore. But those are just for campus. They're not open to the public. Other things to note, if you need updates about things that are going on, you can always check york.edu/coronavirus. Also, our presidential search is still ongoing. The Board of Trustees and the search committee has extended that application process until April 30th. And information about that can be found online at york.edu/presidential-search.
Thank you, Emily. And Madonna said, we had one more come in on chat.
Okay, it looks like I have something from Nebraska Lutheran in Waco. They will be offering meals to seniors in Waco Monday through Friday. The clarification is I believe the school is preparing and delivering them to the seniors. They can contact Cheryl Kraft at the Waco Village.
Thank you. Anyone else from the business sector? Okay, so let's move on to our, I guess that was education, sorry. Let's move on to our faith community. Any nonprofits want to report, or any churches want to report? Cindy or Aaron, are you on? Aaron?
Yes, Erin is here. Good morning, everyone. This is Erin with the York County Health Coalition. Yesterday, we were informed by Nebraska Children in collaboration with the Buffett Early Child Institute that last night at 6:30 Central Time, 7:30 Mountain Time, they launched a Nebraska Early Child Care Relief Fund. So for licensed child care providers who are still currently serving children, they can apply online. The link was on our Facebook yesterday for a one-time $1,000 award. The application they tried to make very simple. It's a 9-question survey monkey type thing. Those applications are being reviewed on a first come, first served basis. Because we have contacts with Nebraska Children through our collaboration, York County is one of those counties that is eligible for that. They are looking for more funding at this point with those $1,000 scholarships. They're only able to fund about 250 right off the bat, but they are encouraging everyone who is a licensed child care provider who is still open to apply for that, as they are looking for more funds to help with those operating costs, because we know childcare is a really important thing any time of the year in any season, regardless of COVID-19 or not. Do want to highlight that it is Child Abuse Prevention Month, along with various other types of awareness regarding domestic violence or other kinds of violence. We know that during stressful times like COVID-19, when families are home more and not in the sights of teachers or childcare providers or the community at large, those numbers can go up. So please be aware, try to stay connected as much as possible, ask those questions in delicate ways, connect with the Child Advocacy Center, Hope Crisis Center as well. We were hearing yesterday that some of those entities that do support survivors of domestic violence, they are having a little bit of trouble or seeing some decline in where they can help house these individuals. So looking for help with providing hotels and other types of safe housing options for that. Also want to highlight that earlier this week on our Facebook page, we did post a link to a Google Doc that we're trying to keep updated with local resources for families. We're constantly in the process of updating that and making it more user-friendly. If you have information that's not on there, please contact me either at our phone number, which is 402-745-6604, via Facebook, or even by email, which is yorkcountyhealthcoalition@gmail.com. But also want to direct people to the online resource directory that is on the Four Corners website. And that is resources for all 4 counties, York, Seward, Butler, and Polk. I think that's all I have for today, Lisa.
And Erin, do you want to just touch very briefly on the CR program, the community response?
We also, last week we did talk about the community response program. You hopefully have seen some information out on Facebook. The community response program is for individuals, families. They have to have a child in the home or as part of their family unit, whether it's grandparents raising children or an aunt and uncle raising children, who can help get connected to resources. It is a short-term program. There are sometimes funds available for assistance. The aim is to help get families to a more sustainable place. If you have a family that you'd like to refer, or you need to have their permission to refer, it's a voluntary program. Or if a family wants to refer themselves, you can call our office again, which is 402-745-6604, and ask for Bev, who is our central navigator.
Thank you very much. DHHS has nothing to report. They sent us a text. Cindy, do you have anything? Okay, I'm saying she does. Is there anyone else from the nonprofit or from the church sector on? Okay, so moving on, let's go to questions. I'm going to bring Laura back up to wrap this up with any questions, unless Madonna has anything on chat. No? Okay. Madonna, or not Madonna, Rhonda said the Facebook feed is not working well. We're sorry. I think internet is a little slow for everybody when we're all on it right now. I've heard that from several people the last week. Okay. Should I repeat that?
Yep, I'm just want to have everyone, excuse me, everyone has a chance at this point to ask questions. If you'd like to unmute yourself and ask a question, or type it in the chat. Sounds like it's very quiet. So in the interest of everyone's time, I think we'll just wrap this up today. And thank you everyone for tuning in and getting all these local updates. We also just wish everyone a happy Easter. And thank you all for everything you're doing to stay home when you're sick, especially. We just want to make sure that your business and your workplace is able to keep going, and it's such an important part of that if people stay home when they're sick. We do have one more update that just came in. York Housing Authority has apartments if people are looking for housing. So that's some good news. All right. Okay, well, I think with that, we'll sign off. Thank you, everybody.